Hi, everyone. We're so pleased to be part of this amazing endeavor to bring about change and through innovation and collaboration. We at ACLM are honored to be part of this. We think this is the foundation of what we stand for, to collaborate with organizations and people who are trying to bring really amazing new ways of dealing with health and other problems as well. But before we go on, I would like us to introduce ourselves. We're all members of ACLM, which is American College of Lifestyle Medicine. I am Dr. Dean Sherzai. I'm a neurologist, neurobehavioral neurologist, as well as a community activist, researcher, and I work at the Loma Linda University as the Director of Brain Health and Prevention Program. And I'm honored to be part of this group. And we have Dr. Ayesha Sherzai.
Yes, hi, I'm Dr. Ayesha Sherzai. I'm a neurologist, trained in vascular neurology and epidemiology, and I'm the co-director of the Brain Health and Alzheimer's Prevention Program at Loma Linda University.
Then we have Dr. Wes Youngberg.
And yes, I'm Dr. Wes Youngberg. I am a trained lifestyle medicine specialist, trained at Loma Linda University, where I'm also on the faculty of the School of Medicine and Public Health. I had the privilege to be one of the founding directors of the American College of Lifestyle Medicine, and I'm also a fellow with them. And related to our topic, I've been involved in helping reverse diabetes for the last 30 years, so I've seen the transition from management to cure, and we're looking forward to talking about how powerful this can be. I've written a book on that topic called Goodbye Diabetes, and a video series that's actually now translated into Arabic called Diabetes Undone. So let's get into it.
Fantastic. So first off, talking about American College of Lifestyle Medicine, which is we're all part of this, and this has been our life's work. All of us have been about lifestyle medicine, and ACLM has been around for a while. Its goal is to provide quality education and certification and to those dedicated to clinical and worksite practices of lifestyle medicine as a foundation of transformation and change in healthcare. I mean, that's an amazing goal, an amazing vision, and that started around 2004. Dr. Youngberg, you were part of this, and now this has grown to where now we have more than 5,000 members in 7 continents, 14 international societies. And it's basically a lifestyle alliance based on science and pragmatic application. Nothing like this anywhere else. More than 1,000 providers certified by American Board of Lifestyle Medicine. Actually, that doubles every year now because it's an exponential growth. One of the fastest growing healthcare career fields globally, lifestyle medicine. And that comes from the need that existed there, but nobody was providing that vacuum. And all of a sudden, ACLM provided a venue that's not based on hearsay, and based on science. Now, as I said, it's based on launch of economic and policy, as well as lifestyle initiatives that can really be applicable to each individual unique communities. Lifestyle Medicine Global Alliance is one of the initiatives. And the point of Lifestyle Global Alliance is to bring about a common language and a common process. Those are important. Common language based on science and a common process based on real applicable behavioral change models in communities, at the national level as well, as has been shown in many paradigms. Now, before we go on, it's important to kind of define what lifestyle medicine is, because there are so many new fields talking about prevention, but lifestyle medicine is not a soft concept. It is a very science-based, science-driven endeavor. It's evidence-based therapeutic approach, such as food, physical activity, adequate sleep, stress management, and pursuing non-drug modifiable variables that can bring about change when it comes to chronic diseases. Now, for the last 100 years or more, I mean, prior to that, we're not going to count because it was a little bit amorphous. We've been working on disease. And that's fantastic. We know that we have to deal with certain diseases. But we have learned that prevention and lifestyle prevention is the key here. 80% has to be focused on that. And that's what we've been doing as American College of Lifestyle Medicine. It's a validated, highly effective way to address root causes of diseases. Not just say that here's you have diabetes and here are some pills, but what are the root causes at the individual level, at the family level, and the community level? And if we don't approach it in that complex way, as you've seen, it just keeps increasing, doesn't it? We keep talking about it, but all we do is highlight and watch the curve just increase. And more importantly, engaging, which means each community, these soft words are used, which is personalized medicine. You and I, Dr. West, we've talked about it. It's personalized medicine and this and that, but nobody really knows what that means. Well, what that means is what we call community-based participatory research, community-based participatory application. And you've done this at the community level as well, which is applying it to each community, each person in the way that it applies to them and sticks to them. And that's not a soft concept. It's a concept that is now being universalized by ACLM. Again, the pillars of ACLM, or lifestyle medicine in general, actually, is nutrition, sleep, exercise, substance abuse, stress management, healthy relationships, and cognitive factors. More than a professional association, ACLM is a galvanization, organization, and bringing together of a database-based change. And that's a powerful concept. ACLM is composed of members who are passionate about the urgent need to transform healthcare. More importantly, I say changing our system from sick care, which is important, to healthcare, which is mostly prevention, and so we can push the disease model back. Our organization addresses the needs for qualified education and certification. Again, that certification and database approach is repeated over and over again, because then you can reproduce that anywhere in any environment, and you can be confident that it's not just a momentary or a false model, but something that comes from tried and true methods. Education, empowerment, and equipping individuals and communities is at the center, because you can't just throw information at people. You have to give them the resources to be able to bring about change. Aisha and I we're in charge of the largest brain initiative in the country, and in collaboration with ACLM in Beach Cities, where we're not just giving lectures, but we're working with the community to see how those behavior changes can be brought forth in those communities. The first step in any change management approach is to educate the leaders. And by the way, leaders are not some title that somebody's given you. Anybody who chooses to bring about change and wants to make a difference in other people's lives, but by definition are leaders. So leadership model is not the classic leadership model, but anybody who wants to bring about change. And we've seen that in ACLM, where thousands of physicians who've been certified go back to their communities and bring about massive change not just in their little practice, but in their region. That's the power of creating leadership with empowerment and tools. ACLM's mission is simply to advance evidence-based lifestyle medicine as value-based specialties that transform, redefine, and sustain health. What does that mean? So if I'm a neurologist, and Aisha's a neurologist, you're a diabetes specialist and lifestyle specialist, each of us can bring these principles, science-based principles, into our practice and have a common language. That's why, Dr. Youngberg, you and Aisha, as a stroke specialist, I'm a dementia specialist, we can actually work together, because at the base, at the principle, we can be assured that the data is accurate and we can work through the same principles and empower each other. Now, why are we doing this? Because the point is to address non-communicable diseases. Those constitute more than 80% of the diseases and costs that afflict our communities and societies. 80% of heart disease can be prevented, strokes, type 2 diabetes, and 40% of cancers. And we've shown, along with other organizations, that 60 to 90% of dementias, which is the fastest growing epidemic, can be prevented. Now, for the last decade, we've talked about prevention of diabetes, but let's talk about how effective it's been using the classical models. Today, we have 422 million adults who have diabetes. That's 1 in 11 people. Those numbers are actually disputed because it depends on how you define diabetes, and Dr. Youngberg, you'll speak to that a lot more in detail. Diabetes prevalence has been rising more rapidly in low and middle income countries than in high income countries. Not that it's not rising in high income countries, but it just gives you a little perspective of how fast it's rising. And the numbers of people with diabetes that has risen from 108 million in 1980 to 422 million by 2014. And by now, it's actually even higher. And diabetes and insulin resistance are the driving force. And this is why we're talking about diabetes today. When we talk about diabetes, we're not just talking about diabetes. We're talking about a foundational disease, a core disease, because behind most chronic diseases that afflict our nations and our communities, diabetes and insulin resistance are at the core of those diseases. This makes diabetes and diabetes prevention one of the most important diseases to address in healthcare. When we talked about ACLM's involvement, and even though I'm a dementia specialist and Aisha is a stroke specialist, we said if we had to be most effective and address one disease process, it would be this diabetes, because that will address so many other diseases and as well. So having said that, I think I kind of laid it up for you to set it up for the next steps, Dr. West. I have a question. I mean, and it's a question that I'm sure the audience has. Is you've been leading in this fight for decades. Now, I'm not trying to age you, but it's been a good fight. No. And you were one. Yeah, you were one of the first people to talk about prevention where it was not popular. We were one of the first people to talk about preventive neurology, which was now it's become popular. We coined it. But prevention of diabetes has been your bailiwick and your fight for the last 15 to 20 years. And so given that, where do you see this prevention model? How does it apply? It's important for people to realize that we can actually talk about the prevention of diabetes. So nobody better than you to address that question or that concept in general.
Yes, thank you, Dr. Sherzai. What's really interesting here is that, what we can prevent in terms of type 2 diabetes, we now know, based on the title of this talk, that we can actually start moving from management to cure. We can actually start talking about reversal of type 2 diabetes. And the three of us are actually presenters on a new course that the American College of Lifestyle Medicine put together, highlighting for the first time there's a society now in the field of medicine and public health that is spearheading the concept that we don't have to just rely on prevention, even though prevention is very possible. And as you were saying, the majority of diabetes can be prevented if we follow the principles that you alluded to earlier. What we're learning now, and there's an 18-hour course for health professionals now available just this year, certifying health professionals on how to actually bring about reversal of type 2 diabetes and insulin resistance, which, as you pointed out, Dean, is really the tip of the iceberg. I learned 30 years ago to be real effective in lifestyle medicine, you had to first be really effective at addressing the preventive, therapeutic, and reversal aspects of type 2 diabetes. If we can do that, if we know how to do that, we can actually take on the broader burden of disease as well. There is definitely a great potential to diminish this scourge of diabetes that you pointed out worldwide is way over 400 million people. It's 1 out of 11 people, but it really, we're all at risk. There's countries that have high incidence. The Middle East has an average incidence or prevalence of 15% of adults. That's huge. And what we're saying is that is largely preventable. We can prevent most of that, if not over 90% of that. And we know that Qatar has a prevalence rate of 17%. You know, but we're not doing that much better in the United States. We have 13%, and a lot of people are undiagnosed as well. So no matter where in the world that we live, there is a huge burden of disease that is brought on because of insulin resistance and because of type 2 diabetes. And we, as leaders in the field, and the many policymakers that are looking and listening to this program, either live or in the future, should rise to the challenge and recognize that we need to stop just putting our efforts into managing diabetes. We need to put much more effort into prevention. Okay, to what are the tenets of prevention that we'll go over. And those same tenets, broadened and made more aggressive, can be used to actually reverse the majority of individuals that have type 2 diabetes. Okay, and I'd be happy to go over those statistics in a little bit. Do you want me to talk about the transition from management to cure now, or after Ayesha talks?
Right now, this would be great for people to see how we've actually changed our perspective, and this change in perspective has been kind of forced by the massively rapidly rising chronic diseases. Us in the healthcare field, we see this, that no matter the old tried and true methods have not worked. We're just increasing the prevalence. But for somebody who actually went through this transition or actually had a hand shaping that transition, it would be lovely for you. It would be wonderful for you to kind of give that perspective.
You know, what was started it all for me was when I was a student at Loma Linda University, and this was the spring of 1985. I remember it well. I attended a seminar series put on by the university on dealing with chronic disease. And one of the keynote speakers for that was Dr. James Anderson, the chief endocrinologist at University of Kentucky at Lexington. And he had been doing research on reversing diabetes for 20 years. This is back in 1985. And I remember sitting with my jaw down, just awestruck at study after study after study that he had himself published and reviewed on reversing type 2 diabetes. And I'm thinking, I've never heard this before. So many of you policymakers and healthcare professionals that are watching this right now, you're going like, what crazy talk is this? Talking about management. We're failing at the management of diabetes. How in the world could we ever expect to even begin to reverse it, right? So that's the current conundrum and the belief. And so we got to be careful what we believe in healthcare, because what we believe determines our policies and determines what we try to do with our patients. So at any rate, that was the beginning of the watershed year in my life, 1985, when I started preaching that. I became an evangelist for reversing type 2 diabetes. And I had the privilege to participate with Dr. John Kelly, who eventually was the founding president of the American College of Sports of Lifestyle Medicine, that took this program to the Marshall Islands, a group of islands in the Western Pacific that had a scourge of diabetes, a very high prevalence of diabetes, and many of them were dying from complications of kidney failure, etc. And so I helped them develop their very first reversal of diabetes program in the Marshall Islands. So in 2004, as I'd been preaching now for basically going on 20 years about the reversibility of type 2 diabetes, I was asked by the president of a medical society to speak at their regional medical conference. And he says, Wes, would you talk about reversing diabetes with nutrition? You know, he knew that I was a plant-based nutritionist, that I was really passionate about encouraging people to eat a plant-based diet, because as you know in your work in dementia, that's such a critical factor in improving health in a dramatic way. And so I said, you sure you want me to follow the title Reversing Type 2 Diabetes? Because the medical community, even though it had been in the research, in the literature for decades, was still not accepting that paradigm, was not accepting. So he said, oh yeah, they'll love it. So I give this talk, right? at this huge conference, double ballroom, lots of physicians and other health professionals there. I gave this talk on reversing diabetes, and then the chairman of the scientific committee gets up at the end of my 90-minute talk, and he says, I just want to go on record that I totally disagree with Dr. Youngberg's assertion that type 2 diabetes can be reversible. And you could have heard a pin drop in that audience. And it's a long story I won't go over right now. But the bottom line is that there'd been a presenter prior to me who was a geneticist and had talked about the potential future of reversing diabetes through genetic engineering. And so I took that, so rather than confront the person who was in charge of the conference, I said, the good news is that we now know that you can use genetic reengineering by changing your diet through epigenetic transformation and to following these strategies that the American College of Sports Medicine, of Lifestyle Medicine has emphasized over these years. So 2 days later, I was listening to the news, and a big study on bariatric surgery came out showing that 77% of diabetics who had bariatric surgery were cured of diabetes, had completely reversed their diabetes at 1 year. And so that was the beginning of the general medical community reconsidering the idea that type 2 diabetes was not reversible. It's interesting how surgery or some other treatment will catch on, but something that we've been doing for decades through natural lifestyle means didn't catch on until after that. Ironically, that was the very year that Dr. John Kelly and others of us, just about 11 of us, came together and founded the American College of Lifestyle Medicine. And of course now, it's gone way beyond us. I mean, this just is a huge, as you pointed out, Dr. Sherzai, this is a revolution. This is an idea that has caught fire and is going global. And there's many societies around the world from different countries that have taken on this challenge. So that we're proud of the fact that we can take the leadership role in showing that diabetes is in fact reversible. Now, there's two other points I want to make, and then I'll turn it over to Ayesha because she's got a lot to say on this as well. And that is, prior to 2009, there had been no official recognition by the American Diabetes Association or other world councils on when you can say somebody's actually reversed their diabetes. It's like if somebody ever became obese, they would never be non-obese because they were just tagged with that obesity tag for life, no matter how much weight they lost. And so if you're a diabetic, you're going to be a diabetic for the rest of your life, and that was the mantra back many years ago. And so in 2009, finally, after much pressure because of the research that those of us that we were doing on this coming out in the peer-reviewed medical literature, finally in 2009, the American Diabetes Association had a task force that had a consensus developing conference, if you will, that came out with a criteria for saying that somebody had reversed their diabetes. So we were all excited that, hey, now it's official, you can reverse your diabetes. But here's what happened. There was a study that was published in 2014 in the journal Diabetes Care, which arguably is the pinnacle of diabetes medicine in academia. And in that study, they looked at 122,000 individuals, okay, that it's a large medical group that looked at, if you follow usual care, standard of medicine, how many of those individuals with diabetes were able to reverse diabetes over a 7-year period. And that figure comes out to 1.47%.
Oh,
now,
amazing.
Now you as policymakers, many listening to this conference would say, like, I'm not going to put any money, any effort of my time into something that only works 1.47% of the time. But here is the challenge. That's true if you follow usual care, if you follow your usual policies, if you follow what you've been doing in the past, that's all you get. And so for instance, in Qatar specifically, the prevalence of diabetes is double what it is globally. Okay, it's 7% of the entire disease burden in Qatar is due to diabetes. 10% of all premature deaths due to diabetes. Wouldn't it be nice if we could just reverse that? Anybody who has diabetes, reverse it. Anybody who's at risk of diabetes, prevent it. Think about the impact that would have on our economy. Think about the impact that would have on the lives and the family life of individuals that otherwise have to spend half of their time in kidney dialysis units. So this would be an amazing thing. And what we're suggesting at the American College of Lifestyle Medicine is that this is doable, that the vast majority of people with type 2 diabetes can actually reverse their diabetes, but only if our policies and our programs are appropriate. I loved the opening remarks of Her Excellency yesterday, where she talks about cultivating practices that center human connection and empathy, empowering communities with knowledge and tools to build healthy and resilient societies. You can't have a resilient society if a huge percentage of your population has the complications of diabetes that Dr. Yesha Sirsai is going to talk about. That you just can't have a resilient society if that happens. And we want to change that. And then she talks about, I love the fact that she has a master's degree in human rights. So if anybody would understand it would be her, that we need to give hope. We need to stop telling people that you're going to have this disease for the rest of your lives. We need to flip that around and say, we're going to switch from management to cure. We're going to help you figure out what it takes to be able to reverse this lifestyle related disease. And we're going to give you the tools and provide the services that American College of Lifestyle Medicine can help any nation, Qatar, any nation, anywhere in the world, how to do this. That's what we do, right? And so basically we want to give people hope and reverse this scourge. Now, the last thing I want to say, so that went from 1.47% in a usual care medical community, but if you actually provide hope, so now people are motivated. Why would somebody change anything in their lives if they're being told that it can't be reversed, that you're stuck with it now? Why would they do it? So I had the privilege to be involved in this detailed online group program that's very environmentally conscious as well, that is teaching people how to eat 100% plant-based diet. And just in 2018 rather, we did a group over the summer, a six month group of about 20 individuals. These are individuals that had diabetes for decades. They had failed many other attempts to really address this, and by careful attention to detail, by providing the right level of service for these individuals, we were able to reverse the diabetes of 67% of them. These were now early diabetics that had just been diagnosed. These are people that had been around for decades suffering with the problems of diabetes. And so we're here to tell you that this paradigm shift from management to cure is real, and we want to be a part of the solution for you.
This is wonderful. I mean, I fully agree. Aisha and I, we've done research for the last 15 years on prevention of dementias and strokes, and we've written a book, Alzheimer's Association, around the same concept. And although it wasn't popular at first, now it's becoming the norm. But it's a little more than that. And that's why ACLM and the rest of us that have been working at this, it's one step ahead of that, which is how do you actually apply that at the individual and community level? I wanted to ask Aisha, and you and I have had conversation about this, is it's not just diabetes, it's the end stage diseases that diabetes leads to. I would love to hear your perspective on those.
Yeah, I think you you pointed out a very, very important thing. And as Dr. Youngberg just mentioned, you know, the disease itself is devastating, but it doesn't exist in isolation. It's a nidus for so many other diseases as well. And it's the complications of diabetes that we as doctors who work in the emergency room, in the hospital, in the communities, and in our clinic, we see that on a day-to-day basis. So, you know, regardless of our specialties, whether we're surgeons or neurologists or ophthalmologists, we actually come across this devastating disease every single day in our communities. Let's just start with the #1 cause of mortality and morbidity in the world, which is cardiovascular disease. And cardiovascular disease accounts for about 52% of deaths in type 2 diabetes. And even when you adjust for age and socioeconomic status and other non-modifiable risk factors, diabetes actually is a main risk factor for cardiovascular disease, whether it's heart attacks or myocardial infarction or congestive heart failure or atrial fibrillation. All of these diseases are affected by the abnormalities in metabolism of glucose. We know that heart failure is 2 to 3 times higher in diabetics. And so these are numbers, you know, and I was preparing for this conversation. The numbers just blew me away. They're astounding. But you know, when you look at the day-to-day effects of these diseases, you know, everything we're focusing on are medications and acute treatment of these complications of the disease. So it's about time that we address the main source of the pathology of the diseases. Let's take some other diseases like kidney diseases. You know, chronic kidney failure is highly prevalent in diabetics compared to non-diabetics. About 40% of patients who have diabetes have some level of chronic kidney disease, and they end up having end-stage renal disease, and they become dependent on hemodialysis and so on and so forth. And you know, the economic implications of this is enormous as well. When you look at other microvascular complications like retinopathy, which is, you know, damage to the small blood vessels in the retina, which is essentially an extension of the brain. Up to 21% of patients with type 2 diabetes have retinopathy at the first time of diagnosing their disease. So that can be actually the manifestation of diabetes in a lot of people. But most diabetes patients actually have some level of retinopathy as they move forward with the disease. And again, the implications are quite devastating. Imagine all the human power lost, the intelligence and the time lost with dealing with these you know, chronic complications of the disease. Another neurological disease is neuropathy, which is a serious complication of the diabetics. Up to 50% of diabetic patients have neuropathy, and this is damage to the nerves, the small nerve endings of limbs, whether it's the feet or the hand, causing a lot of pain, causing a lot of disability. And we know from research from our studies that managing diabetes can actually significantly affect the outcomes of neuropathy. We rely on, you know, large doses of medication and some procedures to get rid of the pain. But if we manage glucose levels very well, this can be healed. This can actually be treated. You know, as a stroke neurologist, with lifestyle as well, yes. As a stroke neurologist, you know, I work at a stroke unit. So, you know, stroke is a devastating disease where people come in with a sudden onset of a neurological deficit. They're either blind, or they can't speak, or they can't see, or they're paralyzed in one side of their body forever and ever. And it's a very sudden onset. And it affects a lot of people. In United States alone, 800,000 people suffer from stroke every year. It's quite devastating. And we know that diabetes contributes significantly. Diabetics are at a higher risk of developing both ischemic stroke and hemorrhagic stroke, up to 2 to 3 times higher risk. Mm-hmm. And, you know, for something as stroke where, you know, you see the devastation and they're left with it for the rest of their lives and they end up getting rehabilitation, you know, it's quite important to actually manage it, prevent it to begin with. But even after somebody's had a small stroke, if diabetes is managed properly and reversed, their outcomes are better. They need less rehabilitation. They actually get better. And then dementia. Dina and I, we both work in the dementia clinic. Dina is actually going to speak about it too. But we see the devastating effect of diabetes on dementia and Alzheimer's disease. So dementia is the umbrella term, which essentially means when people have difficulty with their memory and cognitive function to the point where they can't do their activities of daily living. And diabetics have a higher risk of developing dementia. And Alzheimer's disease is the main type of dementia. And we, in our work, in our research at Loma Linda University and now at Beach Cities Health District in the Healthy Minds Initiative research, where we're following 1,000 individuals and we're seeing the effect of lifestyle on their brain health, we know that about 90% of Alzheimer's disease can be prevented by addressing diseases like diabetes. And one of the things that people don't really address, we always talk about the bigger diseases, the end stage, which is dementia, is vascular cognitive impairment. And vascular cognitive impairment essentially occurs when there's damage to the small blood vessels of the brain, these very important vessels that provide oxygen and nutrition to crucial areas of the brain that are responsible for processing information, decision making, judgment, and all other cognitive domains. That gets affected significantly with not just diabetes, but even pre-diabetes or insulin resistance. So even before people are diagnosed with diabetes, any abnormality of glucose metabolism can affect very, very important parts of the brain. And we are our brains. We are the decisions we make every day. We are the combination of all the cognitive domains that we carry, that we nourish, and that we nurture. So it becomes more than just a disease. It becomes more than just some label, some diagnosis. It almost becomes a tremendous responsibility on each and every person, not just doctors and healthcare providers, but each and every person to inform themselves about this disease. And I'm so privileged to be here as part of the ACLM team to talk about the importance of addressing this, not just in the clinic and in the hospital, but in our communities. Dean?
Yeah, this is important because ACLM's mission is not just in the United States, and it's global. And whenever we know that something as important as diabetes and insulin resistance, which, as I repeat, is in many ways, a foundational disease which affects all the other downstream diseases, or many of the other downstream diseases. And we now know, with the work of Dr. Wes Youngberg and others, and our own work as well, that you can significantly reduce or prevent and even reverse diabetes. Then it becomes an imperative that we actually start in that process. But it's not just ACLM is not just a organization that creates edicts and sends it out and talks about it. It's a functional, systematic organization that creates a process. And that process even includes technology. So you have to be at the edge of a change. Some of the things that ACLM has done, let's talk about diabetes in itself. I mean, the ACLM has focused on many diseases, but diabetes at its core is foundational. The courses that Dr. Youngberg spoke about earlier that have been created is available to thousands of people already have taken it, and it's available throughout the world. And we think it's incredibly important for physicians, for clinicians to participate in those courses, because they're not just didactics, but they are teaching process that gives you the tools and equipment to actually apply it to your communities. That's important. It's to change something from just a didactic to an empowering tool. It's a world of difference, which comes out of practice, repeat, iteration, and learning. That's what these courses are. The other things that ACLM have undertaken is these special interest groups. I love those, which people around same interests get together and exchange thoughts. And that's important, because what happens in Qatar is different than what happens in San Bernardino, then it's different what happens in some province in Detroit or in London. All these individual experiences give us the tool to make it much more real life application, and these special interests serve those purposes. Yes, Dr. Youngberg.
Yeah, I'm so excited that one of the people that is listening and watching us live is actually the director of the Qatar Metabolic Institute.
Yeah.
Thank you so much for participating in this conference, Doctor. This institute just recently published an amazing study. You should have been part of our training module for the American College of Lifestyle Medicine. That was published in the Lancet Diabetes and Endocrinology, arguably one of the top journals and medical journals in the world in this area. And it was just this June of 2020, entitled "The Effect of Intensive Lifestyle Intervention on Body Weight and Glycemia," blood sugar levels, in early type 2 diabetes. And he pointed out to us just a few minutes ago that they were able to show a 61% reversal of type 2 diabetes at 2 years. Congratulations to the Qatar Metabolic Institute for having the foresight to actually put on such an amazing study, basically actually being good academics, taking advantage of the literature that's already been published and saying, we can do this also in Qatar. And so this is going to make it so much easier for policymakers, for government workers, for doctors in not just Qatar, but throughout the whole Middle East and the rest of the world, to take on this passion of what is possible. We no longer have to rely on just struggling with the management of type 2 diabetes. If we don't give the tools and the knowledge and the hope, then people are going to be struggling with this condition and having all the complications that Dr. Ayesha just pointed out. Whereas if we take on the perspective that the Qatar Metabolic Institute has, okay, and seeks to reverse it and provide the resources and the hope that it can be done, we're in a very good position. So congratulations, Qatar Metabolic Institute.
Absolutely.
And there's a question that somebody, sorry, Dean, there's a question that somebody pointed out that actually is very important, and I think you can wrap it up with that statement about the importance of community. The question is, do you find that different demographics might be less likely to adopt lifestyle management measures to combat the disease? I'm not talking about access to healthcare or communications infrastructure. I'm talking more about active refusal. So there are variations of acceptance in different communities.
Absolutely, and that's where this collaborative model comes in. If we don't address each community's needs, resources, their level of health education, their readiness for change, all of those things, all we're doing is, just applying some academic concepts on a population and fail them again and again and again. We've seen this in the United States, where studies would be done on a given population, a very rigid population in Boston, and then applied to a completely different population in California, and it would fail over and over again. And then they would say that, oh, the idea doesn't work. It's not about that. That's why working with organizations like the Metabolic Institute in Qatar is critical, because if we don't learn from their practices, all we're doing is applying something in the United States there. So what ACLM does is take the best practices as far as research is concerned, as far as behavioral models are concerned, and collaborative leadership models, and then apply change in those communities. Without that, all we're doing is having meetings and meetings and summits and summits and conferences without any truly implementing and making a difference in communities. So you're right, Dr. Westberg, this is incredibly exciting, and to hear that we have a partner, whether Dr. Abu Samra knows it or not, we have a partner in Qatar who's doing the work in the community level, which we can learn from and they can learn from us. And together we bring change, which is foundational and meaningful. That is exactly, I had a big talk at the end as far as what ACLM does. That's exactly what the whole point of ACLM is. Find the latest data, find the partnership in the communities and at the individual level, and applying it in a way where it actually sticks and makes a difference. It's database driven community partnerships at the community level and at the national level. So we're incredibly proud to be part of this endeavor. And we're hoping to actually expand the endeavor to Qatar and the neighboring regions as well.
Thank you very much.
Thank you so much. Thank you so much.
Thank you, everybody.
Have a great day. Thank you.